Hello, I'm here to help you understand what to expect before, during, and after your tonsillectomy. Let's walk through this together. What is a tonsillectomy? Your tonsils are two small, oval-shaped tissues at the back of your throat. They're part of your immune system, acting like tiny guards that help fight germs, especially when you're young. Sometimes, though, those guards stop doing their job and start causing trouble. They swell, get infected often, or block breathing at night. A tonsillectomy is a surgical procedure to remove the tonsils. It's one of the most common and safest ENT surgeries performed today, and it can make a big difference in improving sleep, breathing, and overall wellness. Why is it done? Your ENT may recommend a tonsillectomy if you've had frequent throat infections, typically 5 to 7 or more per year. You have sleep-disordered breathing or obstructive sleep apnea caused by enlarged tonsils. You have chronic tonsillitis, swelling or pain that doesn't fully go away between infections. There's an abscess or a growth that needs removal for biopsy. In short, it's about restoring comfort, reducing infections, and improving quality of life. Before the surgery, you'll meet your surgeon to review your medical history, allergies, and medications. If you take blood thinners like aspirin or warfarin, you'll be told when to stop them, usually about a week before surgery. Fasting. No food or drink after midnight the night before surgery. This is very important for anesthesia safety. When you arrive, you'll meet your surgical and anesthesia teams. The surgery is done under general anesthesia, so you'll be completely asleep and pain-free. The procedure itself usually takes 20 to 40 minutes. The surgeon opens the mouth gently using a special instrument and removes the tonsils through the mouth. There are no external cuts or scars. Bleeding is controlled carefully, often with a small cautery device or surgical sealant. Once everything is clear and the area is stable, you'll move to recovery as the anesthesia wears off. When you wake up, your throat will feel sore. Yeah, that's completely normal. Some people also feel a bit of ear pain afterward, which actually comes from shared nerve pathways, not from an ear problem. Let's go through recovery step by step. Pain and swelling. The throat will be sore for 7 to 10 days. It may peak around days 4 to 6. This is when scabs start to loosen and healing tissue forms. Your doctor will prescribe pain medicine. Take it as directed, even on schedule at first, to stay ahead of the discomfort. Eating and drinking. Hydration is your top priority, right? Sip water often. Dehydration is the main reason patients end up back in the hospital after tonsillectomy. Start with clear liquids like water, popsicles, or ice chips, then move to soft foods like mashed potatoes, pudding, or scrambled eggs. Avoid sharp, crunchy, or spicy foods that can irritate the throat. Activity. Rest is important. Avoid vigorous activity, heavy lifting, or sports for about 2 weeks. Light walking is fine and helps with recovery. Appearance. When you look in the mirror, you'll see white or yellow patches where the tonsils used to be. That's normal healing tissue, not infection. You might notice mild bad breath for a week or two. That's also part of normal recovery. Risks and warning signs. Tonsillectomy is very safe, but knowing what to watch for is important. Normal symptoms include mild sore throat or ear pain, white or yellow patches, light bleeding from the nose or throat on day 1 or 2. Call your doctor right away if you notice. Bright red bleeding or spitting up more than a teaspoon of blood, fever higher than 101.5 degrees Fahrenheit, 38.5 degrees Celsius. That doesn't go away with medication. Severe dehydration, like no urine in 8 hours, dry mouth, or dizziness. Difficulty breathing. If bleeding becomes heavy or continuous, go to the nearest emergency room immediately. You'll typically have a follow-up visit about 7 to 10 days after surgery. Your doctor will check your healing and talk about when you can return to school, work, or normal eating. Most patients feel significantly better after 2 weeks, and by then, sleep and breathing often improve noticeably, especially for children who had trouble snoring or resting through the night. Once recovery is complete, most patients report fewer sore throats or infections, better sleep and energy levels, and easier swallowing and breathing. A tonsillectomy may sound intimidating, but it's one of the most common and successful procedures in ENT care. Keep hydrated, rest, follow instructions carefully, and don't hesitate to reach out with any concerns. Remember, this is a short journey toward a big improvement in quality of life. We're here with you every step of the way.